Hello, my name is Tatum Conklin, and I am currently a graduate student at Baker University School of Nursing. The aim of this presentation is to highlight gaps within the Affordable Care Act and discuss potential changes that would be beneficial to the American people. Table of Contents. This presentation is broken down into 8 sections. The first half includes the introduction, background and identified care gaps, key stakeholders, and recognition of those who would likely oppose this proposal. The second half of this proposal presentation will discuss the appropriate House and committee to involve in the implementation and decision-making process, how to implement the change, and any efforts to expose this bill to the community through social media exposure. Introduction and identifying gaps in the Affordable Care Act. The Affordable Care Act was initiated by President Barack Obama in March of 2010. Since then, the Affordable Care Act has profoundly impacted the healthcare network in the United States, fundamentally reshaping how care is accessed and delivered. The Affordable Care Act, or ACA, aimed to address issues of accessibility, affordability, and quality within the healthcare system. By expanding Medicaid eligibility and establishing health insurance marketplaces, the ACA has significantly increased the number of insured individuals, particularly those among the low-income and marginalized population. Additionally, its emphasis on preventative care and essential health benefits has improved health outcomes as more people can access necessary services without prohibitive cost. The legislation has also introduced important consumer protections such as prohibiting denial of coverage due to pre-existing conditions and fostering more significant health equity. While challenges remain, the ACA has laid a critical foundation for ongoing healthcare reform, promoting a system that aims to provide high-quality care for all Americans and reduce the administrative and financial burdens on both providers and patients. It has also allowed health insurance to become more affordable and readily available to more people by expanding the Medicaid program to cover all adults with income below 138% of the federal poverty level. Some of the policy gaps that were identified include how several individuals are still uninsured, small businesses can't afford to provide insurance to their employees, there has been an increase in out-of-network providers, businesses are cutting hours to avoid covering higher health insurance premiums for their employees, and healthcare organizations are starting to turn away patients without healthcare coverage. Background, rationale, and data supporting the proposal. Small businesses with fewer than 25 employees can qualify for a tax break that will help them pay for up to 50% of their employees' health insurance premiums. However, small businesses with 25 to 50 employees do not qualify for the tax credit to help cover the premiums. As long as employers have fewer than 50 employees, they cannot be fined for not offering health insurance coverage. If a small business opts to provide health care coverage to its employees, it must comply with the regulations of the ACA. Businesses with fewer than 50 employees qualify for the SHOP program. This is a health insurance marketplace with lower premiums. However, I attempted to search for the cost of coverage for small businesses in both Osage and Shawnee counties, but a flag alerted me that there are currently no health insurance plans offered under the program in our area. In 2022, the Employer Health Benefit Survey showed that small businesses and employers who provide coverage decreased from 69% to 51% due to an increased cost of health insurance premiums. From 2016 to 2018, premiums rose by 61%, while enrollment dropped by 38%. Premium cost remains the primary indicator of enrollment, as subsidized enrollees generally benefit from increased gross premiums and the subsidized unsubsidized are harmed by premium increases. It has been shown that 66.5% of all bankruptcies in the U.S. involve medical debt. Overall coverage expanded from 74 million Americans to 100 million Americans by the year of 2020. However, 17.4 million of these individuals gained insurance coverage through federally funded Medicaid programs. Federally funded cost increased by $35.6 billion in 2022 compared to 2017. It is estimated that up to 3.3 million individuals enrolled in Medicare are currently are not actually qualified to receive payments. Initially, 14 states refused to expand Medicaid programs. This led to a decrease in overall healthcare coverage within those states. After the ACA was passed, some providers were no longer considered in-network, forcing several individuals to leave practices that they were established with and to find a new provider. In February of 2024, it was estimated that the United States had $220 billion worth of unpaid medical debt. For this reason, healthcare organizations have begun to turn patients away who do not have health insurance coverage due to the fear that they will not be compensated for medical expenses and provided services. This leads me to the proposed solution. Addendums to the Affordable Care Act would include providing basic health coverage for all American citizens. This policy would give each individual an equal opportunity for necessary health care, including annual doctor's visits, preventative care measures, and treatments and medications for both chronic and acute conditions. Insurance premiums would be federally funded, however, patients would still be required to pay a percentage of out-of-pocket cost, just like we do now. There would still be programs that disabled individuals could apply for to help cover the out-of-pocket expenses. By providing coverage of the cost of insurance premiums for all, this gives both the working community and the unemployed community an equal opportunity to receive quality care while also making out-of-pocket cost more affordable to everyone, leading to more medical bills being paid on time. Secondly, federally funded grants would be provided to employers who offer supplemental health insurance policies that cover items such as dental and vision care as well as specific elective treatments. Tax breaks would be given at the end of the year to those in the working class, similar to the child tax credit that's provided to parents. This would help to encourage individuals to join the workforce and to help cover accrued out-of-pocket costs from the prior year. Lastly, elective procedures that are not covered by insurance will be required to be paid up front to ensure that healthcare organizations will be compensated. The goal of these changes would help to decrease the out-of-pocket cost covered by the federal government by encouraging more individuals to seek preventative care before they require expensive treatments or medications to manage chronic conditions such as diabetes and heart disease. This will also help small businesses because the cost of high insurance premiums would no longer be a concern. More people would likely be willing to work for small businesses knowing that they would still have baseline insurance coverage without relying on their spouse's insurance plan that is provided by their employer. The aim would also be to increase the number of providers considered in-network with government-funded insurance plans. However, supplemental insurance companies may still pick and choose which providers are in-network. This would also help to cover and lower out-of-pocket expenses, as well as encouraging eligible individuals to join the workforce instead of relying on government-funded programs. The government will be able to cover the cost of insurance premiums by reassessing those who are incorrectly enrolled in Medicaid programs, as well as funds being saved by encouraging preventative care. Encouraging more people to join the workforce will also decrease funding that is currently being funded through Medicaid programs. Key stakeholders, essential support for the policy proposal. One of the primary stakeholders of the ACA includes healthcare providers. It is suggested that healthcare providers are the primary beneficiaries of this policy, and the ACA has been referred to as a dowry from the Supreme Court to mid-levels and physicians. Due to significant increase in revenue for health care organizations, the American Hospital Association has become supportive of the bill. Requiring patients to have health care coverage decreases the number of uninsured patients being seen by providers and the overall occurrence of unpaid, uncovered medical expenses. It also predicted that the number of patients seeking health care will increase after gaining health insurance coverage, and the patients resistant to seeking medical care will have a new willingness to receive necessary treatments. Health insurance companies will likely be negatively affected due to an increased tax liability that decreases overall cash flow for insurers. Health insurance companies will no longer be allowed to deny coverage of pre-existing medical conditions, including medications, treatments, or procedures. Lifetime benefit limits will also no longer exist with the new guidelines of the ACA. Insurance companies will be required to pay more towards medical expenses, resulting in a loss of billions of dollars. The ACA will indirectly impact pharmaceutical companies due to the increase in overall healthcare visits, which is predicted to increase the number of drugs physicians prescribe. While the overall revenue for prescriptions will increase, pharmaceutical companies must provide discounts on certain Medicare-covered drugs, lowering the profit on specific prescriptions. The drugs that fall within this category are referred to as being included in the donut hole. Lastly, this law strives to end the competition between drug manufacturers regarding brand name and generic drugs. Opposition. Plans to gain support from individuals against the change. The American Medical Association, also known as AMA, advocates for physicians and medical students on various issues including access to healthcare, patient care, and medical ethics. They represent physicians in courts and legislative bodies nationwide. The other opposing entity would be the Republican Party. Both groups have expressed similar concerns about the Affordable Care Act. These fears include the government gaining control over the healthcare system, as well as medical providers and patients losing their right to choose when it comes to practice techniques in healthcare. They fear this would decrease the quality of care patients receive by being limited to in-network providers, what is covered by insurance, etc. Additionally, inadequate compensation to medical providers, organizations, pharmaceutical companies, and medical equipment suppliers is a concern. In countries that currently have universal health care, wait times are significantly longer than those in the U.S., particularly for appointments with specialty providers. Lastly, a common concern is that the Affordable Care Act is a gateway to becoming a more socialized healthcare system. The opposing parties could gain support through data comparing current nationwide medical debt that has been left unpaid, costs for paying Medicaid plans, as well as what financial resources would be saved if more individuals were able to receive preventative care, and comparing those expenses to what it would cost to cover health insurance premiums for a basic health care plan. You could also offer to do a trial period just like the ACA did, and if the numbers are significantly different, then they could go back to the drawing board to find other solutions. Not to mention the amount of Americans that have filed bankruptcy due to the financial burden of not being able to afford healthcare insurance, and the government or healthcare organizations have to eat those costs. House proposal. Who will the bill be introduced to? The Affordable Care Act was passed by the Senate and then sent to the House of Representatives for approval. Therefore, any changes on the bill, such as this proposal, would follow the same steps. The bill has to be approved by both the Senate and the House of Representatives. After the bill has been approved by both chambers of Congress, it will then be sent on to the President in order for the bill to be implemented into law. Both the House Representatives and the Senate are required to approve the bill to ensure that it accommodates diverse perspectives and considers all relevant priorities. This also enables both sides to discuss their concerns and reach a mutually beneficial compromise or agreement. If bipartisan support is not reached, then the likelihood of the bill passing is slim to none. The House and Senate represent different populations. For example, the House is more directly representative of the population, whereas the Senate focuses more on the smaller states. Committee involvement. Which committee would be most appropriate? The Patient Protection and Affordable Care Act was primarily shaped by 4 congressional committees, which included 2 in the House of Representatives and 2 in the Senate. These 4 committees included the Senate Finance Committee, the Senate Health, Education, Labor, and Pensions Committee, also known as the HELP Committee, the House Ways and Means Committee, and the House Energy and Commerce Committee. This proposal, which includes addendums to the Affordable Care Act, would involve the same 4 primary committees. The Senate Finance Committee and the House Ways and Means Committee both play a key role in aligning tax provisions and overall funding mechanisms in the ACA. The House Energy and Commerce Committee oversees the health-related aspects of the ACA, including insurance regulations and access to healthcare services. Implementing change, lobbying for the policy proposal. Some ways to lobby for improvements to the Affordable Care Act include identifying specific policymakers who would be influenced by your arguments and then connecting with them during meetings or by contacting them via phone, email, or other means. Next, you could attend relevant meetings that plan to discuss similar concerns, which would allow you to meet policymakers and build rapport with them. Timing the proposal around major voting periods would also be helpful, as well as attending outreach programs to raise awareness on the issue, collaborating with organizations and other individuals with shared goals, sharing real stories of individuals negatively impacted by the current policy, and staying informed with the current developments within Congress. 4 groups or organizations that could potentially help lobby for changes to the Affordable Care Act would include the American Hospital Association, the American Nurses Association, the National Health Law Program, and the Kaiser Family Foundation. The American Hospital Association is recognized for advocating on behalf of the ACA and its representation of hospitals and healthcare organizations. The American Nurses Association protects the rights of nurses and prioritizes high-quality patient care, thus its values align with the aim of the Affordable Care Act. The National Health Law Program is an organization that publishes issue briefs on Medicaid protections and actively advocates for expanding access to affordable health care. Lastly, the Kaiser Foundation provides research and analysis on healthcare issues, including the ACA, and actively communicates its findings to policymakers and the public. Media exposure, informing the community through social platforms. The proposal would likely be introduced to the media by explaining the primary goal of the changes being made to the policy and by highlighting the benefits of this new policy to garner community support through government websites such as healthcare.gov. After initial exposure through these platforms, the proposal would then likely hit news headlines. After being displayed on these news programs, the information would then spread to various other platforms including Facebook, TikTok, Twitter, Instagram, and others. Topics that would be addressed include disagreements from both sides of the Congress and the reasons why they are for or against the implementation of the policy. News officials would also likely discuss the financial resources that would become available to Americans and what this would mean for the federal budget both in the short and long term. Media exposure can also be achieved through public outreach campaigns, which would help educate the public on the provisions of the bill and the impact on healthcare access, cost, and government intervention. And lastly, references.